Hi, my name is Michael Burley, and today we'll be treating an inversion ankle sprain which was sustained yesterday. This is an example of acute inflammatory condition. One of the best treatment modalities for this condition is a cold hydrotherapy bath. Next, we'll be going over some benefits for this treatment modality. Hydrotherapy cold baths can be used in place of an ice pack because they cover the entire extremity for increased contact, and you also can see the treatment area while performing the treatment. Cryotherapy is good for three things: controlling inflammation, pain, and edema. By controlling inflammation, you create vasoconstriction for 15 to 20 minutes of treatment use. By controlling pain, decrease nerve conduction velocity, and also can decrease the pain threshold via the gating mechanism. Lastly, for edema, studies show that cold can reduce edema when applied in the first 2 days after injury. In addition, hydrostatic pressure applied through full immersion of the extremity should aid in endomatis control. Next, I'm going to be going over some contraindications and precautions. First, I'll start with contraindications and precautions to using immersion-based hydrotherapy. They include maceration around the wound, bleeding, impaired sensation, infection in the area, confusion or impaired cognition, and recent skin grafts. Now, there are also some cryotherapy contraindications and precautions. For contraindications, include cold hypersensitivity, cold intolerance, cryoglobulinemia, paroxysmal cold hemoglobinuria, Raynaud's disease, over-regenerating peripheral nerve, or peripheral vascular disease. For precautions, over a superficial main branch of a nerve, open wound, hypertension, poor sensation or mentation, and then for the very young or very old patients.
Okay, now we would go through the process of the actual treatment application with our patient here, myself. First, you're going to have to get a tub. You want to clean and sanitize the tub before bringing it out. Next, you're going to want to take the patient here, seated, make sure the opposite limb is supported, and when we insert the aforementioned limb into the tub, you want to make sure that the patient does not have the sides of the tub impact the sides of their leg too hard. There's not much pressure. You also want to make sure the limb itself is fully immersed into the tub, at least 6 inches above the injury site. So here we have the tub. You want to make sure the temperature of the tub is between 32 degrees and 79 degrees Fahrenheit, or to patient comfort. I have assessed the temperature of the water itself, and it is 33 degrees Fahrenheit, so cold. First, also, if the patient, you want to assess for contraindications, which we went through before, and we want to make sure if the patient has any cardiovascular issues, which he does not, that we assess all vital signs, including respiration rate, blood pressure, and heart rate. So the patient here will place his foot into the tub.
You ready?
Yeah, go for it. So I would give the patient a timer here and come back probably in about 5 minutes to assess the look of the limb, make sure there's no hypersensitivity, and the patient will sit here for 20 minutes, and when the timer goes off, he could remove his foot. So if the timer did go off now, we want to make sure the patient removes his foot. Place here lightly, your ankle sprain. We would dry the foot and make sure to keep it wrapped as if so there's no chill.